talk about updating the whiteboard and setting it up for the first time. So make sure you grab your cardex because all the good information is here. I have my patient Janie, and I'm going to be asking her questions as we go through the whiteboard. So to start with, we're going to put the date, which is, today is October 23rd, and it's a Tuesday. The RN is Trinity, the LPN is Lorraine, and Paul. So we're just going to go through. So with this patient, this is the mobility section. If it's not filled out, we need to fill it out to the best we can, and if we're unsure, to please ask the physiotherapist. The physio will also fill it out and sign it on the bottom. So her mobility is a 2-person assist, med lift, I guess this must be for PT, med lift, and a universal sling. And then we have different things here. I'm just looking. So diet, she's a general, and she's a setup. It also states here that if the patient is not eating, to tell her that her husband has paid for it. So I'm going to write that in here. And we can talk a little bit about my goals. So Janie, what are your goals for the day? What kinds of things do you want to do during your day while you're here to help you stay better?
I would really like to get up and walk 3 times and make it to the end of the hallway.
Okay, and then we can look at care needs. So in just looking at some of the things that are up in here, they want her to get dressed, to wear her clothes, during the day. And she's also part of pieces. So I'm going to put a little star, and I'm going to put the DOS because we're supposed to be filling out the DOS tool for her. She is a high risk of falls. So we have a sticker for fall risk, and she's had a fall. And she had a fall on October 19th at 8 o'clock in the morning. She's also hard of hearing. Tests and appointments, actually, let's see if she's got anything booked. I don't see anything, but you would mark something in here if she was going for an echo or whatever in time. And her estimated date of discharge for this patient is unknown, as she is for long-term care. So you could put long-term care or just leave it blank, but if we know the date of discharge, we would mark the date in. So this is what a good whiteboard looks like, completely filled out. These are filled out daily or per shift, so it's an ongoing tool that needs to be continuously filled out. So this is our walking board that we update daily. Patients that physio deems that the staff are able to now walk up to 3 times a day, they can put a check mark here so that anybody who's in can know that they've been walked once or twice. No one yet so far today has been walked. It's still the morning, and then they need to document that they've been walked in the nurse's notes, in the acute flow sheet or the rehab flow sheets.